Okay, we should be ready to go.
All right, thank you so much, Maddie. Hi, everyone. My name is Michelle Spotts, and I'm the Community Engagement Coordinator with the Network of the National Library of Medicine, Pacific Northwest Region, or NNLM for short. NNLM is an outreach program of the network, or excuse me, of the National Library of Medicine, the world's largest biomedical library. Our mission is to advance the progress of medicine and improve the public health. We accomplish this by providing equal access to biomedical information to healthcare professionals and by working to improve the public's access to health information in order to support their ability to make informed decisions about their health. Before we get started, I just want to review a couple of quick housekeeping items. You were muted upon entry. If you're having trouble with audio, which you probably can't hear me saying this if you're having trouble with audio, please put a message in the chat box and our tech colleague Maddie will help you. There is live captioning available and you should see the CC button on the bottom of your toolbar and you can just click on that to enable it. This session is being recorded and it will be available online for viewing later. And at the end of today's program, we'll have a survey, a link to a survey, and I highly encourage you to please take a moment and fill out the survey. It's really short and sweet, and it will help us with our training and future programs. So let's take a look at our objectives for our time together. And what we'll be covering is a little bit about the All of Us research program. So I'd like to introduce that to you. Understanding the difference between misinformation and disinformation. I'll share some key evidence-based health resources for health practitioners and also some key patient health resources this afternoon. So let's go ahead and get started. And if you are familiar with the All of Us research program, hopefully there may be a little bit of new information for you. And the same thing goes for the network of the National Library of Medicine. If you have worked with us or use our resources, then hopefully I'll be able to share some new information with you today. So the All of Us research program aims to build one of the largest, most diverse data sets of its kind for health research, with 1 million or more participants nationwide who will sign up to share information on their lifestyle, biology, and environment over time. The mission of the All of Us research program is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. The goal of the program is to help researchers understand more about why people get sick or stay healthy. By looking for patterns, researchers may learn more about what affects people's health. The program aims to reflect the diversity of America through its participants. All people living in the United States, not just citizens, will be eligible to participate. All of Us will be a resource for many studies and is a cornerstone of the Precision Medicine Initiative, which looks at a person through the lens of environment, biology, and lifestyle. If someone decides to join All of Us, they will be asked to share different kinds of information. The program will ask for basic information such as name and address and questions about the person's health, family, home, and work. It will also ask for access to electronic health records, and it may ask for bodily samples such as blood or urine. Through a greater understanding of why people get sick or stay healthy, we hope to discover better tests, better mobile apps to help people and encourage healthy habits and health monitoring, and better medicine or information about how much of a medicine is right for each person. As I mentioned, the mission of the All of Us Research Program is to accelerate health research and medical breakthroughs and enable individualized prevention, treatment, and care for all of us. And there are four primary ways that the program hopes to accomplish this mission. One is through nurturing relationships with participants and being very transparent about the data and the research that's being conducted. Another is to deliver and build the largest, richest biomedical data set. Um, and the third aim is to build and maintain an external and internal strong all of us team, and to catalyze a robust research ecosystem. These are the core values that are central to the All of Us Research Program and the foundation upon which the program is built. And I've covered many of these points in the opening remarks about the program. The All of Us Research Program is committed to doing things differently. The program is taking a transformational approach to diversity. It seeks to achieve something it calls quadruple diversity, which is defined as people, geography, health status, and data types. So for people, the program seeks participants from all backgrounds and walks of life. For health status, that means a commitment to bringing people in of all health statuses. This is not a disease-specific program. And geography aims to build a community of participants from across the United States. And data types refers to pulling together all different kinds of data measures, including biological, clinical, social, behavioral, lifestyle, and environmental. So there's no manual for a project like this. There's no standard agreed upon definition of what comprises an underrepresented and biomedical research population. But what we do know is that in order to ensure quadruple diversity in all of us, the program must create value and build trust for all communities, particularly those who have understandably become distant and hesitant to participate in research. The program is engaging and partnering directly with key stakeholders, trusted community and provider organizations, and participant partners. And it is acknowledging and addressing these important issues head on, because it must. The program must build trust and create value with all communities. So the question always comes up, what's in it for me? So what is the promise to providers? For healthcare providers, the research gained will potentially allow for more effective and appropriate care. Research conducted using All of Us data could help show better understanding of the impact of environment and lifestyle factors on health. We will get a better understanding on risk factors and treatment response for diverse populations, and new knowledge will allow for more effective care and more impactful research on diseases across the lifespan of the program. So that is a really high-level overview of the All of Us Research Program. If you'd like to know more, I invite you to visit their website, joinallofus.org/NLM, and you can definitely learn more about it there. I didn't mention this at the beginning, but at the end of our time, my presentation, we will have time for questions and answers. So if there are things that are popping up in your mind, hold on to them or jot them down, and we can address those at the end of the presentation. So now let's talk about mitigating misinformation. So I don't really need to tell you that we're living in extraordinary times. Unfortunately, the COVID-19 pandemic serves as a significant reminder of the importance of evidence-based health and medical information. We've all been navigating our way through the current COVID-19 pandemic, and everyone here knows that information is coming at us fast and furiously. We also know that the pandemic has been fraught with misinformation and sadly, some disinformation. This slide illustrates early news stories on treatments for COVID-19. These were screenshots taken in March 2020. And we know this type of misrepresentation of science is still very much alive in our world. And it's no wonder that patients come to their office visits with preconceived ideas. So it's important to recognize that there's a distinction between misinformation and disinformation. And I have these definitions here on the screen. Misinformation is the creation and spreading of false or inaccurate information without malicious intent, while disinformation is the creation and spreading of false information with the intent to deceive. So it's purposeful. Misinformation and disinformation can have an alarming impact on a person's trust and an understanding of a topic. It's important to recognize the primary distinction between misinformation and disinformation is intent. Someone who spreads misinformation may simply be uninformed, whereas someone who spreads disinformation does so as part of a specific agenda. As healthcare practitioners, I'm sure your patients often share misinformation about their health and self-care strategies. So talking with your patients about something they believe is true yet isn't, and educating them about evidence-based practice will help them be more savvy patients and healthcare consumers. Excuse me. So an American Journal of Public Health perspective offers insight into how healthcare providers might successfully approach patients' misinformation. This approach focuses on inquiry and curiosity to draw the patient into a conversation. It's a non-judgmental approach. They advise viewing the discussion as a patient teaching opportunity, as well as an opportunity to learn more about your patient. They advise asking an open-ended question to find out where the patient is getting their information from on which they are basing their healthcare decisions. Asking such a question opens the door for conversation. It doesn't blame or shame. And so they have an example here on the screen. What have you already heard or learned about your treatment and condition? This article is available online, and I believe Maddie may be sharing these links as we go along with you today. And I will share them with ORHA after the program to send out to anyone who's interested in having these links. So understanding misinformation as a force in a patient's life also calls for assessment and understanding of the patient's own lived context. Often patients' experiences or those of their friends and family affect how they relate to medical information. Medical error in their care or that of a loved one may lead to mistrust of the healthcare system in general. And these individuals are more likely to believe misinformation that is focused on the dangers of traditional therapies. Similarly, so do experiences with health inequities and experience or knowledge of historic mistreatment. And of course, religious and spiritual beliefs and cultural norms contribute to patients' ideas about their bodies and may affect therapeutic choices. To help alleviate patient-held misinformation, the American Public Health Association advises these two steps: acknowledge, listen, and empathize while pointing to appropriate information sources, and empower patients with accurate sources of information to meet their own needs for self-education. And as part of our time together, I'll share some free evidence-based resources to respond to patient information needs. Before we take a look at some of these resources, I wanted to share a couple of fact-checking, debunking health misinformation websites with you. The first is factcheck.org. It's a project of the Annenberg Public Policy Center, and they have a part of their website called SciCheck. And SciCheck focuses exclusively on false and misleading scientific claims. And you see the URL at the top of your screen, and hopefully Maddie will be sharing that in the chat box. This is typically disinformation spread by partisans to influence public policy. However, I've noticed they are focusing especially on the COVID-19 information right now, misinformation, excuse me. And then another website is the Center for an Informed Public at the University of Washington. Their mission, which you can see on the screen, is to resist strategic misinformation, promote an informed society, and strengthen democratic discourse. However, they really are, you'll find that they really are addressing COVID misinformation, and you'll find information about that on their homepage and in the resources section of that website. Now let's look at some key health practitioner resources. And again, just to reiterate, everything I'm going to share with you this afternoon is free. It's a really, really good price, right? Free. So because COVID is so front and center in all of their lives, I want to share the National Institutes of Health COVID-19 website. This is for both clinicians and the general public. It has all things COVID on it with a focus on current research, clinical applications, and clinical trials information. And something that I thought might be extremely relevant to you is the clinical practice guidelines that you'll find on this website. And to locate those, you will want to pull down the treatment and vaccine tab and click on treatments. And then you'll get to the treatments page, and there's a link to the treatment guidelines. Of course, you can bookmark the URL, which is at the top of this page. This is the clinical guideline page. Excuse me. And it is updated frequently. I think I last did this on April 8th, and they had new things. So I would imagine if you check this page today, there might be new information there for you. An easy way to navigate through these guidelines is to use this toolbar on the left. So you can go right to critical care or antiviral therapy, whatever specific topic that you want. And then this website was just released on Friday. It's called We Can Do This. It's a Department of Health and Human Services website. And it's to, excuse me, promote public education on COVID-19 in order to help increase public confidence in the COVID-19 vaccine, and also to underscore and support other measures such as social distancing and wearing a mask in order to prevent the spread of the virus. The resource features a lot of different resources for different audiences and in different formats. The resources here are available in 8 different languages. The formats are diverse, from TV ads to social media posts, fact sheets, videos, a number of different things. And then the audiences are broken down really into different racial, ethnic, demographic types of groups. So older adults over 65, African Americans, Latino or Hispanic Americans. So you can zero in on a specific resource. Now, if you scroll down on this home page, there'll be an opportunity to join something called the COVID-19 Community Core. And so I signed up for that myself last Friday, really not knowing what was going to happen. I assumed I was just going to get updates when things may be added to the website. But yesterday, excuse me, through this community core, I was invited to sit in on a presentation by Dr. Anthony Fauci and Dr. Vivek Murthy on the J&J vaccine halt. And so they each talked about that a little bit, and then there was a live Q&A session. So I thought that was really an awesome thing to be able to participate in. So I encourage you to join the community core with me. Our next tool is called PubMed.gov, and it's the National Library of Medicine's free authoritative database of more than 32 million citations to articles in the field of biomedicine and health and related disciplines such as life sciences, behavioral sciences, chemical sciences, and bioengineering. The database has a specific focus on original scientific research published in journals and online books. And the citations may include links to full text content. Perhaps during your training, you used a resource or a database called Medline, and Medline is the name that is used when a third-party vendor like Ovid or EBSCO licenses PubMed to repackage it for their users. And while these vendors charge for you to access Medline, PubMed is always free and freely available. So that URL is simply pubmed.gov. And if it's been a while since you visited PubMed, it was completely updated last November. It has a whole new look. So this is the homepage. If you scroll down on your homepage screen, you'll find this little section called Clinical Queries under the Find icon. And this Clinical Queries uses a specialized search method with built-in search filters that limit retrieval to citations that are more clinically relevant. So if you're in a hurry or if you don't want to wade through 32 million citations, this is a really quick and easy strategy to limit your search results. We're going to come back to this in just a minute. But first, I want to start with some basic search strategy. So if I'm in my home screen, I can use the search bar just like Google, only better. And it's important to note that the search engine has what we call automatic term mapping. You probably know it as smart search capability. And that means it just intuitively will translate what is typed into the search box and map it to appropriate terms. So in this case, if I just put in Alzheimer, it's going to map it to Alzheimer's with an apostrophe, without one, and so forth. And it will look for variant spellings as well. So if I do put Alzheimer's in the search bar and I hit search or press enter, it will take me to my search results. And you can see that it linked correctly to Alzheimer's disease. But you may also note that I retrieved over 180,000 results. And most of us wouldn't have time in a typical day to wade through all of those results. So one thing I can do is either go back up to the search bar and enter more keyword terms to narrow down my search, or off to the left-hand side is this menu of search filters. And again, this is a partial page view. If you scroll down, you'll see a number of additional filters. So each time I apply a filter, I'm going to narrow my search results. So in this case, I'm going to refine it to meta-analysis, which is the highest level of evidence. And when I do that, I can see that I did check meta-analysis if you look down the left-hand side of the page. And my search results have been reduced from over 180,000 down to around 1,500. So that's still a lot, and I can continue to choose filters or enter more keywords in my search bar to keep refining that number. And then a couple of quick things about navigation. Anytime I want to end a search, I can check that X in the search bar box, and that will clear the search and I can start again. And if I'm ever lost and I want to go home, I can just click on the pubmed.gov icon that's always in the upper left-hand corner, and it will take me back to the home screen. So let's take a look at that clinical queries approach that I mentioned. So clinical queries actually performs dual searches simultaneously, and it returns results for COVID-19 articles specifically on the left-hand side of the screen, and then clinical study categories on the right-hand side. Excuse me. So if I am going to do a search, I'm going to want to refine using this category pull down menu that will get me to the most specific search results. And the same thing would be true for the clinical study categories. And I apologize for this tiny little screen here, but you'll want to do two things if you're looking under clinical study. And the first is, again, to pick a category, and you'll do this on both sides, COVID-19, clinical studies, and then also be sure to pick a scope. It will default to the broad scope, which gives you lots and lots and lots of things. I always choose the narrow scope. I figure I can always go back and cast a wider net if needed, but typically the retrieval is pretty large. So I tend to choose narrow, or at least start there. Okay. So if we want to find information on whether or not to continue metformin in someone who's been diagnosed with COVID-19, we can do that search here in clinical queries, and we would just type in our keywords, so type 2 diabetes and metformin. And we would also want to make sure that we've visited those drop-down menu boxes and chosen treatment, therapy, narrow search, whatever it is that we want to refine our search with. When we press enter, we see that we have 31 results on the left side. So the COVID-19 articles, there are 31 results. On the clinical study categories, I can't get my clicker to work. There we go. We have over 2,000 results. And because my request is specific to COVID-19, I'm really going to focus on the results on the left-hand side of the screen. So I can scroll down, and if I want to see all 31, I simply click on that. It brings me to my 31 results. And I can, look through each of these. There are abstracts for all of these articles available. And I noticed that some of them have a free PMC article next to them. And that means that the full text is available of this article for free. To see that, I click on the title of this article, so prescription of glucose lowering therapies and so on. And it brings me to the page that tells me about this research study. And then in the upper right-hand corner, I see the full text link. And I'm going to click on that. And then here is the full text of this journal article. And I can either read it fully online, or I can click and download the free PDF. And Elsevier, the publisher that's offering this for free, normally has a paywall for full text articles. What we found during COVID-19 is that many journal publishers are offering any article on COVID-19 research freely available. So that's a huge help. Not all of them are doing that, but many of them are. And they will be, there will be that little free PMC article designation for each of these that you can download the free version. And of course, it's on mobile too. So an interesting thing about this is it's not an app, it's a website. And it's a responsive website, so it will look correct on your mobile device, either your smartphone or your iPad or whatever you have. But you will want to bookmark the URL on your mobile device so that you can quickly pull up this resource and use it. Okay, all right, taking a breath here. And then we're going on to more resources. So through a state agreement with OHSU, Oregon licensed health providers have access to a resource called Access Medicine. And this may be familiar to you because it has full text of clinically relevant books like I always say Lang, but maybe you say Lange, Current Diagnosis and Treatment Series. It has Goodman and Gilman's Pharmacology and Harrison's Internal Medicine. So the current diagnosis and treatment series, and then those other two items. In order to use Access Medicine, you need to have an OHSU library card, and you can sign up for one on the website here. And again, that's freely available to you through a statewide agreement. This is another part of that OHSU offering. If you scroll down from the resources page, you'll see this reprints desk also located there. This is only available to Oregon licensed MDs and DOs. So if you're an Oregon MD or DO, your state licensure fee supports the service for you. So I hope it's something that you already know about, but if not, it might be something that you want to avail yourself of. It will allow you to receive full text journal articles that will be emailed to you. So let's say you're searching on PubMed, you find something that really looks relevant to your clinical information need. It's not available full text on PubMed. You can come to the reprints desk and request it, and you'll get a free copy emailed to you. Okay, and then medications questions come up a lot. So if you're not familiar with it, there's a resource called Daily Med. Again, it's free. Daily Med is the official provider of FDA label information. It provides a standard, comprehensive, and up-to-date lookup of medication content and labeling. So these are the things that are in the medication package inserts that you can search on this website. So this is a screenshot of remdesivir. So if I'm wanting information about that, put in the search box, this result comes up. Down the main portion of the page is the drug label information. It's categorized so I can just zero in on a specific aspect of information that I'm interested in, or I can use that navigation bar off to the left-hand side of the screen. Okay. There is also a portion of this website available for patients. I haven't found it particularly useful for that purpose, but just so you know, it's there. And right under the drug label information, you can click to the patient version if that's something that you would find helpful. And then the Rural Health Information Hub is a resource provided by let me make sure I get this right, the Health Resources and Services Administration, so HRSA. And I encourage you to explore this site because you'll find a wealth of state level information specific to rural healthcare in Oregon, along with many evidence-based toolkits to support rural practice and rural health. There are also free webinars and videos that are offered. There's an online library with resources, all offered through the lens of what is important to rural health practitioners. And they have a newsletter that you can sign up for if you want to keep abreast of new tools and things that are available to rural practitioners. The Oregon Office of Rural Health supports the health of rural Oregonians and also the practice of rural health in the state. And again, they offer many helpful resources and tools on their website. And the URL is there. And now we will move on to some key patient health resources. And I'm going to share my very favorite one with you first. And I actually call this website, medlineplus.gov, the gold standard for patient and public health information. It's just very, very current and comprehensive. And the entire website is available in both English and Spanish. So if I want to view the Spanish language site, I can click on the Espanol link in the upper right-hand corner, and it will take me to the Spanish homepage. And on every page on the website, you have that ability to toggle back and forth. Okay, so I'm going to just quickly review some of the content on the site because it is so comprehensive. Of course, starting off our health topics, you know, everything under the sun seems to be covered there. But I want to call your attention to the drugs and supplements section because it has information in lay language provided by the American Society of Health System Pharmacists on both prescription and over-the-counter drugs. So, you know, we looked at Daily Med and it has the patient version. This is much clearer and easier for patients to understand. And the other interesting thing about this section is it covers herbs and supplements. And I wish it would say that on the link there, but that's really important because many patients use herbs and supplements, and this has evidence-based information about their safety and efficacy. And that information is updated, and the whole website is updated constantly, I would say daily. There's a section on genetics, and as we talk about precision medicine, this becomes more and more important. So there is information here in lay language on genetic and inherited disorders, and then information on understanding genetics and genetic testing. And then a broad category of medical tests. So again, lay language information on medical lab tests in particular. Okay, so quickly cover some searching tips. And Medline Plus has a smart search engine. So if I'm looking for information on Meniere's disease, as I begin to type it in, Medline Plus starts thinking, you know, what is she looking for? And it tries to help me. So I'll start seeing these terms pop up. I can pick Meniere's disease and it will take me, whoops, I don't want to do that. there we go, sorry. It will take me to this page, which has a lovely summary in lay language of Meniere's disease. I also see, though, that I have 66 results, which again, that's a lot. So I'm going to refine by type, and I'm really interested in this as a health topic, so I'm going to choose that. And I have 3 results. And something to remember about these results is that if a result is bolded, that means it's a primary topic. So that's the one that I would choose here to explore. And that will bring me to an entire page. It's almost like a website to itself on Meniere's disease. And all of the information is located here. If I want to quickly navigate, I can use these links in this blue barred box to quickly get to something like diagnoses, patient handouts, and so forth. And for new diagnoses, I've always found it best to start with the start here. So that section comes up first, which is nice. Generally, those are like broad overviews of a diagnosis or condition. Okay, I mentioned that Medline Plus has information on herbs and supplements, and so does the National Center for Complementary and Integrative Health. And this is a series of fact sheets on different herbs and botanicals. And there's really some great evidence-based information here. It's all in lay language, so patient language. It talks about what the science says about what is being learned about the herb and its use as a medicine. It talks about the safety as well as contraindications. So does it interact with a prescription or over-the-counter medication? So this is really handy. There is also something even handier, which is an app called Herblist. So Herblist is the app name of Herbs at a Glance, and you can download it for free at the iPhone App Store or Google Play. And then it's, right on your smartphone or your handheld device. And if I haven't said it, all the resources I'm talking about today are free. And I'd be really remiss if I didn't mention our Oregon Rural Health Association. They have resources on their website that are very helpful. And one in particular I wanted to highlight today, which is under their list of resources. Whoops, got to go forward here. Is something called the Medication Assistance Tool or Medicine Assistance Tool, or MAT. And this was created by the Pharmaceutical Research and Manufacturers of America. And the site allows users to search through various biopharmaceutical industry programs and financial assistance resources for eligible patients, their loved ones, or patients in their care. So it provides healthcare providers, patients, and their loved ones with a single point of access to hundreds of public and private assistance programs, as well as connecting them with more transparent information about the cost of medicine. I spent 20 years as a working with patients in a health resource library for a hospital, and this was a question that came up over and over again, people needing assistance with their medication and the cost of those medicines. So I'm really happy to know this tool is available and it's free. Okay, that is all of the prepared content I have for you today. I know I went pretty quickly, so I'm here to answer any questions as best that I can. Maddie is going to allow you to be unmuted if you want to ask a question or if you want to pop one into the chat box. We'll field those questions now. And then also a gentle reminder that we have a survey for you to please fill out. that you can give us some feedback about today's program. And I believe Maddie will be putting that link in the chat box for you as well. Okay.
I've updated the settings so people can unmute themselves if they want to ask any questions. And also, if you post in the chat box, I'll read them out loud to Michelle.
Great. I feel like I need to have some Jeopardy music going or sing the Jeopardy tune.
Okay, just reposted the survey link.
Okay, thank
Yeah.
you. Yeah, I can see that you did get the links in there.
Mm-hmm.
Any questions, comments, things you want to contribute to for the good of the group?
We have a thank you.
You're very welcome.
Hi, Michelle. Can you hear me okay?
I can.
Hi, this is Juanita. I apologize. I'm in an area where I know it's going to be loud, so I'm going to make this quick. But I was just wondering, I have a random question actually. I was wondering who monitors the mesh terms for PubMed, or if that's an opportunity that providers should know about. I know in my work it is, but I'm not sure who oversees that, and if terms change over time based on feedback or how that works. Just wondering if you had any insight.
I have a little bit of insight, and I really appreciate that question. And I didn't talk about mesh terms today, but mesh, if you're not familiar, stands for medical subject headings, and it's the controlled search vocabulary that the National Library of Medicine has established to search PubMed. So, you know, many individuals will use mesh terms as they search. And I just really illustrated keyword searching today. But to answer Juanita's question, the National Library of Medicine has a whole division that oversees PubMed and the mesh terminology. And it changes every year, actually. It's updated every year. It's constantly evolving as new terminologies, you know, evolve. And so they do actually listen to public input. And I believe there is a way to get that information to NLM on the, I would look at the National Library of Medicine, nlm.gov website for that. I don't know it off the top of my head. I'm sorry about that. Did I answer your question, Juanita?
Oh, yes, of course. As always, thank you, Michelle. That's
okay.
really helpful. And I do use mesh terms quite a bit. So it's good to know that there's a department over it, but also there might be an opportunity to share some feedback to expand on some of those terms.
Yes, there definitely is. They're very responsive. I will say the National Library of Medicine is responsive in general to its users. So, you know, Medline Plus, if you're using that and you have feedback, there's a link. I think it's at the bottom of the page that you can, you know, send comments or suggestions for improvement. So they're really good about that. Other questions, Maddie? I'm not looking at the chat box. So.
I'm not seeing any other questions coming in at this point.
I have a question. So I'm a PA in Malala, and so one of the things that's fairly common to have happen is that a patient comes in, or sometimes my staff too, with misinformation or disinformation, and I would like to give them some kind of simple tool that's guidance about how they can evaluate information for themselves in a way that's more scientific and more accurate, instead of just pointing them to other information, because they tend to be pretty resistant to being pointed to other information. I mean, sometimes they will, but they don't necessarily believe me or necessarily trust. There's a lot of mistrust of the government where I live. And so they're more likely to trust their friends and their peers and their family and Facebook, etc. So what would be like a simple handout or something that I could write up that would be saying, if you're reading this information or hearing it, ask these questions, or kind of like, yeah, what could I use for that?
So a couple of things are kind of running around in my brain, excuse me, and I'm going to invite anybody else here who has some ideas to share them in the chat box as well. But there's something, it's a terrible name, but it's called the CRAP test, and I think it's CRAAP, and you can just, Google the CRAP test for health information. It's an online tool. It was developed by a nursing PhD candidate, and like C stands for credible. And so there's like 2 questions to ask to determine if the website is credible or not. And it takes you through, authoritative, who's espousing this information. Are they an MD, or are they, the guy out on the street? I don't know. So it lists the credibility criteria, so to speak, and then it walks a person through that determination process. It's not a government website, so that, because you mentioned that that's an issue, and it really is in a lot of places, that might be something that they would consider using.
Yeah, no, that's exactly what I was wondering. Yeah, thanks.
Yeah, and then the other 2 things that I mentioned today are SciCheck and then the Center for an Informed Public. And neither, well, I don't know, University of Washington might be considered a government, but the Annenberg Foundation isn't. So that's all I've got on that. I could point you to NNLMs, how do you evaluate health information? But I don't think they would really appreciate that or respect it.
I'm muted. Okay, there we go. Bye.
Yeah. I mean, if you don't agree, we'll get that information to you. But I'm thinking if they're leery of the government, then that might not be the best place to send them.
Right. No, that's sometimes that's sometimes a big issue.
Yeah. And that American Public Health Association article that I mentioned, it's freely available. You can download that for free. And that really, I think, might have some sort of tips and tools to how to approach that in the clinical setting.
Was that one of the links that you?
Yeah, it was a link. And Heather, if you want to privately share your email, we can get in touch with you after the program. Or I'm hoping that, I know Katie is in the room. I hope Katie Harris can send these resource links out to.
Yeah, Katie knows me because I'm also on the Rural Health Association board.
Oh, there you go. Okay, so
Yeah.
Katie, I hope I haven't misspoke, but I thought I could send you the list afterwards. And if you just want to share it out in your newsletter or however you want to do that, that'd be great.
Katie says, I am and I will in the chat box.
Okay, good. All right.
Thank you, Katie.
Any other questions, comments? Did you all do the survey?
I'll post that one more time.
One more time. Okay. And I think we're good then. If no one else has any comments or questions. I want to thank you for being here with Maddie and I today. This is my contact information on this screen. If you're interested in that and following up in any way, I'm happy to correspond or communicate with you, talk with you. And thank you.
Yes, thank you, everyone.